An antiviral pill developed here in Atlanta could soon offer higher-risk Americans the first at-home treatment for COVID-19. This comes at a time of uncertainty about the new Omicron variant and what it will mean for the winter ahead. The Fox Medical Team's Beth Galvin joins us now to talk about this. Beth, it sounds like this Merck pill could really simplify the treatment process for those folks who do get COVID.
Yes, Tom. And I think right now, if you're somebody who's considered at higher risk of having severe complications from the virus, you can get a treatment known as a monoclonal antibody treatment. But that typically means that you're going to have to go into a medical setting and get an IV infusion. This treatment and a similar one from Pfizer involves taking pills right at home.
Nearly 2 years into the pandemic, the FDA could soon authorize the first COVID-19 antiviral pill designed to keep higher-risk adults out of the hospital.
That looks good.
Dr. Richard Plemper, professor in the Institute for Biomedical Sciences at Georgia State University, whose team worked with Emory University researchers to develop molnupiravir, says the pill blocks the SARS-CoV-2 virus from replicating and taking over the body. Merck and Ridgeback Biotherapeutics say molnupiravir lowered the risk of hospitalization and death by 30% in studies if given within 5 days of the onset of symptoms.
The treatment would be started immediately after, for example, a positive PCR test. That means even before the onset of clinical signs. That gives the patient the greatest chance for therapeutic benefit.
Last month, an FDA advisory panel voted 13-10 to recommend the agency authorize molnupiravir for individuals like seniors and those with underlying health conditions that can raise their risk of becoming severely ill from the virus. And the FDA is supposed to make its final decision on the pill soon.
The initial patient group will be elderly, so adults, 60, 65 years of age, and higher with at least one additional risk factor.
Once a person tests positive for COVID-19, Plemper says they could call their doctor, who could then call in a prescription for the antiviral. Pfizer has also developed its own COVID-19 antiviral pill that it says lowers the risk of hospitalization and death by 85%. So far, Plemper says molnupiravir appears to be effective against the new Omicron variant. He cautions that the best way to protect yourself right now is to get vaccinated and boosted.
But I think we also have to have the therapeutic option for those that cannot be vaccinated, for those that do not respond well to the vaccine, for those that may, for different reasons, not be prepared to take the vaccine.
And if it is authorized, the Merck pill will require some commitment. The regimen will likely involve taking 40 pills over the course of 5 days. So, Tom, that is 4 pills twice a day for up to 40 of them, so quite a bit.
Wow. And it's prescribed now. Hopefully, like Tamiflu, eventually it will be available over the counter.
Yes, not prescribed yet. We're still waiting on an FDA final decision.
Okay, good information, Beth. Thanks.